Welcome to the Stronger with Age podcast,
Yeah,
because aging is just the beginning.
I like that tagline.
Yeah, it's catchy, right?
Yeah.
So today we're going to dive deep into AI and robotics
Oh,
and
fun.
how they're becoming really important in elder care.
Yeah, it's fascinating, like how technology is evolving to help us really maintain independence, safety, well-being as we age. This isn't, some distant future thing.
Right, it's already happening.
Yeah. And it's so important because, like, think about it. The global elderly population is increasing so rapidly.
Yeah.
By 2050, the UN, they're projecting 1 in 6 people worldwide will be over 65.
Whoa, 1 in 6. That's a huge number.
It's massive. It means that how we approach care, like elder care, needs to change. We
Yeah.
need innovation.
Right. It's a challenge for sure.
It is, and that's exactly what we're going to unpack in this deep dive.
Yeah, let's get into it.
All right, so we're going to understand, like, where AI and robotics are right now in elder care. What are the actual benefits? What are the challenges, the hurdles? And we've looked at a whole bunch of different stuff.
Oh, wait.
Articles from, those super innovative tech companies, research from institutions, and all those insights from the healthcare world to give us, like, a clear picture of what's going on.
I'm excited to hear all about it. So I guess starting off, when we talk about elder care,
Mm.
what exactly are the needs we're trying to address? Is it just about like physical help?
It's way more than just physical. It's the World Health Organization, WHO, defines it as supporting older adults.
Yeah.
Not just with, like, the obvious things like bathing or getting dressed or managing whatever, conditions they might have, but also, and this is super important, focusing on, like, their social and emotional well-being. Because we got to fight loneliness and isolation. That stuff, it can impact health in a really big way.
Right. Makes sense.
Yeah.
So what one person needs at, say, like 70 versus what they might need at 90, it's going to be different.
Right. Of course, it changes so much, like, what someone needs. It's dynamic, really.
Yeah, it has to be.
Health, living situation, whether you're living on your own, with family, it all matters.
So many factors, yeah.
A lot of factors. There was this study in the Journal of Gerontology. They found that older adults living alone
Uh-huh.
often need more support with stuff like chores, keeping the house tidy, meal prep, all those daily things.
Yeah, if you have mobility issues and you're living alone, even just like basic everyday stuff could become really challenging.
Exactly. And then, of course, you have individuals facing cognitive decline.
Right.
Their needs might be totally different, like memory aids, help with routine stuff.
Okay, so we've got this like huge range of needs. How do we even start to make sense of it all to
Yeah.
categorize them in a helpful way?
Well, there are these frameworks, right? Like, they help us figure out the needs.
Right.
You've got the ADL scale, activities of daily living.
Okay.
It looks at the basic stuff, self-care. Eating, bathing, dressing, moving around. It gives us a snapshot of how independent someone is, like, basically.
Like a starting point.
Yeah, kind of. And then you've got the ICF, International Classification of Functioning, Disability, and Health.
Wow, that's a mouthful.
It is. But this one's broader, It looks at how the health conditions, the ability to function, and the environment, they all play together.
Okay.
It gives a more holistic view, like the whole picture of a person's needs.
So with all these different needs, how are AI and robotics coming into the picture to meet them?
So one of the biggest things, honestly, is that globally, there's a growing shortage of people who can actually provide care. The WHO, they estimate by 2030, we could be short by like 18 million healthcare workers.
18 million. That's a massive gap.
It's huge, and it has really big implications for supporting our aging population.
For sure. And then there's also the unpaid family caregivers,
Oh,
right?
yeah, tons of care is provided by family. The National Institute on Aging says it's about 80% of long-term care in the U.S. I mean, it's amazing, right? Families are dedicated. But it also means there's a big risk of caregiver burnout, emotional, physical, even financial.
Yeah, I can imagine trying to juggle your own life and responsibilities while providing constant care. That must be really hard.
It is.
So it sounds like AI and robotics, they're not here to replace that human connection,
Right.
but they're here to help, to kind of share the load a little bit and to provide support for both the older adults and their caregivers.
Exactly. And we're already seeing some really cool applications of AI, like early on.
Okay.
Research suggests that AI systems can actually detect those subtle signs of cognitive decline.
Right.
much earlier than traditional methods.
Oh, wow.
Think about it. Identifying these changes early could mean earlier interventions, maybe slowing down things like Alzheimer's.
Right, yeah. That's a
Yep.
huge deal. So we're talking about elder care, but how does AI and robotics in this field fit into the broader picture of healthcare?
That's a good question. Across all of healthcare, AI is becoming like super powerful, right? At analyzing all this data, like huge amounts of data. It can spot patterns that we as humans might miss completely. And that can lead to diagnoses that are earlier and more accurate. There was this study in JAMA. It showed that AI could detect breast cancer in mammograms, like really accurately, sometimes even better than human radiologists. And then there's another one in Nature Medicine. Researchers showed how AI could identify diabetic retinopathy from like retinal scans that could prevent vision loss.
That's amazing.
It is.
So it's not just about assisting with tasks, it's also about making diagnosis better.
Yeah.
What about robotics? Is robotics used in other healthcare areas too?
Oh, for sure. Robotics is getting integrated into like so many things. You've got surgical robots that do minimally invasive procedures. You've got automated systems in pharmacies that dispense medications.
Wow.
And for elder care specifically, we're seeing robots that are designed to help with the like physical stuff of caregiving.
Okay.
For example, there's this robot called Robert, and it's designed to help lift and transfer people. So it reduces the risk of injury for both the patient and the caregiver. Then there are robots like Pepper.
I think I've heard of Pepper.
Yeah. They're being used to provide companionship, social interaction in healthcare settings.
That's really interesting. And then there's the whole thing about AI handling tasks that aren't, hands-on, like setting appointments or answering questions.
Oh, yeah, the chatbots.
Yeah.
They're popping up everywhere. They handle like all sorts of stuff, scheduling appointments, refills for prescriptions, answering those common medical questions.
Yeah.
There was a study in the Journal of Medical Systems.
Okay.
They found these chatbots can really cut down wait times and free up staff so they can deal with more complex patient needs.
It does sound super promising. But I guess, like with any powerful tech, especially in healthcare, there are concerns, right?
Oh, for sure. Data privacy and security, that's huge.
Yeah.
People are worried, understandably, about who's looking at their info when AI is involved.
Of course.
There's a study in the Journal of Medical Ethics, and they emphasized how important it is to have strong safeguards, clear rules to protect this data.
Right.
And we need transparency and accountability with AI,
Right.
we have to understand how these systems make decisions, who's responsible if something goes wrong. It was discussed in Science and Engineering Ethics.
Yeah, that makes sense. It's healthcare, it's sensitive information.
Exactly.
So what about the people, like on the ground, the healthcare professionals, the patients themselves? How are they feeling about all of this?
Yeah, some healthcare professionals are a bit concerned, like what will happen to their jobs, as noted in the Journal of Healthcare Management.
Right.
But it's not about replacing people, It's about giving them tools that help them do their jobs better and like take away some of those super demanding tasks.
Yeah.
And for patients, it's all about making this stuff easy to use. Like if the systems are confusing or impersonal, it's not going to work.
Right.
Research in human factors, they say it has to be intuitive, cater to older adults specifically.
So it sounds like AI and robotics are really pushing innovation in healthcare overall, not just elder care,
Totally.
leading to more tailored treatments, as they suggest in the Journal of Personalized Medicine, and even improving outcomes for entire populations, which was discussed in Population Health Management.
Yeah.
Okay, let's narrow it back down to elder care.
Okay.
What types of robots are out there right now that are being used to support older adults?
Okay, so there's a whole variety.
Cool.
First, you've got robotic companions,
Companions.
like for emotional support, social interaction.
Oh, interesting.
Think of robots like Jibo and Kuri.
Okay.
There's research like from Brazil in 2016 and Conda in 2012 that shows how these robots can chat, recognize faces, even show emotions.
Wow. So it's about reducing that loneliness, which we know is, really impactful.
Totally. It can have serious consequences for health.
Yeah. Yeah.
So companionship is one big area. Then we've got assistive robots.
What do those do?
These guys directly help with daily tasks. Like, remember Robert and Reba? We talked about them earlier.
Yeah, for lifting.
Exactly. They help lift and move people. It can be physically demanding for caregivers, right?
Right.
And there's research on them by Yamamoto in 2013 and Mukai in 2010. It shows how effective they can be.
Okay.
And it's not just about the physical help, it's also about promoting independence for older adults and preserving their dignity.
So they can do things for themselves.
Exactly. Now, here's another cool one. Robotic exoskeletons.
What?
I know, right?
Like Iron Man.
Kinda.
Whoa.
They're wearable devices that can make you stronger, improve mobility. There's research by Kawamoto in 2017 and Galliana in 2018. Imagine someone struggling to walk, being able to move more freely.
Yeah.
That's what exoskeletons could do. Better quality of life, fewer falls. It's pretty amazing.
Oh, that is cool. Anything else?
Let's see, we also have telepresence robots.
What are those?
So robots like Double and Beam, they let you communicate remotely. Research by Psy in 2017 and Boise in 2016 shows how they work. It's like a virtual visit.
Oh, interesting.
So family or doctors can check in with older adults from far away.
Okay, so you can be there without actually being there.
Exactly.
Okay.
Super helpful for people who have trouble traveling.
Yeah.
And last but not least, we've got robotic sensors and monitoring systems.
Yeah.
Not your typical robots, like not humanoid or anything,
Right.
but they're systems that are built into the home, like smart home tech.
Oh, I see.
They can track things like vital signs, falls, all those daily activities.
It's like monitoring.
Exactly. And there's research on them, Demiris in 2008, Rashidi in 2013. They show how these systems can alert caregivers or emergency services if something seems off.
So it's about catching things early.
Exactly. Early intervention is key.
Yeah. So we've talked about robots. Now, what about AI for predictive analytics in elder care? What's that all about?
So this is where AI gets really smart. Predictive analytics uses machine learning to look at data, find patterns, and anticipate what might happen with someone's health.
Okay, interesting.
For example, a study in the Journal of Medical Systems showed how AI could predict the chances of someone needing to go back to the hospital.
Oh, wow.
If we can predict that, we can maybe prevent it.
So it's about being proactive.
Exactly. And that data can come from different sources, like wearable sensors that track activity, sleep, even environmental sensors in the home that monitor things like temperature, movement.
Okay.
And research in the Journal of Ambient Intelligence and Humanized Computing showed how important this is for supporting independent living.
By catching those potential risks early, right?
Totally. Before they turn into falls or other problems.
So what about combining this AI analysis with the existing electronic health records, EHRs?
That's where it gets even more powerful. When AI has the whole picture of someone's health history, the predictions can be so much more accurate. Like in the Journal of Healthcare Engineering, a study showed that AI could analyze EHR data and identify patients at high risk of developing pressure ulcers.
Oh, wow.
Then you can take steps to prevent them.
Yeah, that's so important. And what about analyzing the text in those clinical notes?
Yeah, NLP, natural language processing, that can be super helpful too.
Okay, cool. But I'm guessing there are some downsides, right?
Well, there are definitely things to keep in mind. Like the quality of the data is super important.
Makes sense.
If it's inaccurate or incomplete, the predictions won't be reliable. And then there's bias, If the data used to train the AI isn't representative of everyone, the predictions might not be fair or accurate for certain groups.
Right.
And transparency is key. We got to understand how the AI is making its decisions. There's a whole field of research now on explainable AI.
Okay, I can see why that's important.
No.
You need to be able to trust the system, especially when it's making decisions about healthcare.
Exactly, and it takes a team, It's not just AI doing its thing. The Journal of Interprofessional Care, they highlight how important it is for healthcare pros, data scientists, even caregivers to work together to make sure these AI models are not just technically good, but also actually useful in the real world of elder care.
Makes sense. So we're moving towards a more proactive approach. But how are we personalizing that care for each person using machine learning?
So machine learning is really leading the way in personalized medicine.
Okay.
It looks at all sorts of data, genetics, lifestyle, medical history.
Wow.
And then it helps us develop treatment plans that are tailored to the individual.
That's incredible.
Yeah, there's research by Kumar in 2019 and Chen in 2018 that shows just how powerful this can be for older adults with different conditions.
Wow. So it could help figure out how someone might react to a certain medication.
Exactly. And just like with predictive analytics, EHRs are super important here too.
Yeah, I was going to say.
They give us a ton of data, and machine learning can sort through it all to find patterns and predict how someone might respond to different treatments.
Okay.
There are studies by Rajkumar in 2019 and Zhu in 2020 that show how this can lead to better diagnoses and treatments.
That's great. Now, what about precision oncology? What's that all about?
So precision oncology is a great example of personalized medicine in cancer care.
Okay.
Machine learning looks at the genomic data of cancer patients to find specific mutations,
Okay.
and then we can target those mutations with specific therapies.
Wow.
It's amazing. Research by Liu in 2018 and Sharon Tong in 2019 shows how successful this can be. It can predict how someone will respond to different cancer treatments, like immunotherapy,
Wow.
and it can help us pick the most effective therapies based on their specific tumor.
So it's like really targeted treatment.
Super targeted. And it's especially relevant for older adults since they're at higher risk for some cancers.
That makes sense. Okay, so we've talked about the tech, the data, the personalization. But let's talk about the interaction between humans and robots in elder care.
Yeah.
How does that actually look? What's it like for the older adults?
So the big focus is on making those interactions feel natural, comfortable.
Okay.
For robots helping with physical stuff like bathing or dressing, there's research in the Journal of Rehabilitation Research and Development and the International Journal of Social Robotics.
Okay.
It's all about sophisticated sensors, controls to make sure it's safe and comfortable. The goal is to take some of the physical burden off caregivers while letting older adults keep their dignity and independence.
Right, right. And what about those robotic companions? What are those interactions like?
So with those, it's more about the emotional and social aspects. There's research in the Journal of Gerontology and the International Journal of Human-Computer Studies.
Okay.
It shows how these robots can chat, respond to commands, even display social cues. It's kind of like interacting with a pet or a friendly companion
I see.
to reduce loneliness and isolation, right?
Right. Right. So it's a very different kind of interaction.
Totally. And researchers are working on making it even more natural, better NLP, so robots can understand and respond to conversation better. And advancements in social robotics, so they can understand social cues, build rapport with humans.
So moving on from specific tasks and companionship, what about autonomous systems for daily living tasks? What's that all about? And how is it different from the direct interactions?
Good question. So autonomous systems are about providing support without needing constant interaction.
Okay.
Like, think of a robot that can make a simple meal based on preset preferences or dietary needs.
Interesting.
Or AI-powered sensors that keep an eye on vital signs and can call for help automatically if someone falls.
Okay, so it's about creating a safer, more supportive environment through automation.
Exactly. We're also seeing more advanced companions that can be more present, offer emotional support without needing constant prompts.
So like it could learn your routine and remind you to do things or start a conversation at the right time.
Exactly. Or AI pill boxes that dispense meds at the right time and give reminders. And of course, smart homes can integrate all this tech, so environmental controls and safety features can work automatically.
It's pretty amazing. But with all this tech in our homes, what are the safety and security risks?
Yeah, safety and security are super important. Research, like from Broadbent in 2011 and Chen in 2013, highlights how there's a chance of physical harm if robots malfunction or their movements are unexpected, especially for older adults who might have mobility or cognitive issues.
Yeah. And what about all the data these systems collect?
Yeah, Kane discussed this in 2018. The amount of data they collect about daily life, health routines, it raises big privacy and security concerns.
Right.
We got to protect that info.
It's sensitive.
Absolutely. And then there's the question of how these systems will handle emergencies. Research by Failcipher and Materik in 2005 and Klein in 2017 shows that current AI might not always recognize and react properly to new or complex situations.
Yeah, that makes sense.
And then, of course, there's the risk of social isolation, as pointed out by Turkel in 2011 and Ferluzzi in 2004. We don't want this tech to replace real human interaction.
It's a balance, right, between the benefits and the risks.
Totally. We need rigorous testing, regulations, and safeguards when designing and using these systems. Like, Haddadin emphasized this in 2017.
Now, what about the economic side of things? How are AI and robotics impacting the elder care industry financially?
It's a complex issue. There's potential for cost savings through automation and efficiency. A study in the Journal of Healthcare Engineering suggested that robot assistants could lower labor costs in elder care facilities.
Okay, that's a positive. But what about the jobs of human caregivers?
That's the big concern, right? Reports from the International Federation of Robotics talk about potential job displacement. We have to address this head on.
Through training and figuring out how tech can work alongside human skills, right?
Exactly.
But this tech could create new jobs too, right?
Absolutely. Developing, making, maintaining these AI and robotic systems will create jobs in engineering, software, tech support. And by improving care quality and enabling early detection, we could save money in the long run.
Right, yeah. So are there any specific examples of those economic benefits?
Yeah, like in the Journal of Medical Systems, research suggests AI diagnostic tools could make diagnoses more efficient and cheaper.
Okay.
And the McKinsey Global Institute has pointed out potential productivity gains in healthcare through robotics and automation.
So it's mixed bag, but with potential.
It is. Now, what about regulations? What kind of rules are being made to govern all this AI-powered care?
Yeah, that's important.
It's still early days, but there are frameworks emerging. In the U.S., the FDA regulates AI medical devices, making sure they're safe and effective.
And what about data privacy? That's a big one.
Yeah, in Europe, they have the GDPR and the MDR.
Okay.
They set strict rules about collecting, handling, storing personal data, including health info. They also want transparency and give people more control over their data.
That makes sense. Are there regulations addressing broader ethical concerns with AI in healthcare?
Yeah, definitely. People are talking about potential biases in AI algorithms and how to ensure fairness and transparency.
Right.
The IEE and the AAI are working on ethical guidelines for AI,
Okay.
focusing on things like accountability, trustworthiness, and making sure AI aligns with our values.
Are there any countries leading the way in regulating AI for elder care?
Japan's been pretty proactive, probably because of their aging population.
Right.
Their Ministry of Health, Labor, and Welfare has made guidelines for AI care robots, focusing on safety, effectiveness, and user-friendliness. They're also funding research in this area.
So it seems like everyone's recognizing the need for regulation, even if the approaches are different.
Exactly. It's a team effort. Governments, industry people, ethicists, all working together to make sure innovation happens responsibly.
So what does the future hold for AI and robotics in elder care? What are the big questions and focus areas?
Ooh, lots of exciting stuff. One big focus will be on those personalized adaptive systems.
Yeah, the ones that learn and change. Right?
Exactly. Research by Broadbent in 2010 and Feelcipher and Materik in 2005 is laying the groundwork.
And what about early detection of cognitive decline? Is that still a big focus?
Oh, absolutely. Studies from Dodge in 2012 and Kay in 2014 showed the potential of AI there. Early detection means earlier intervention, better management of conditions like Alzheimer's.
Yeah, that's crucial. And what about caregivers?
We got to keep working on ways to help them too, reducing their burden. Developing robots and AI that can do the routine, physically demanding tasks so caregivers can focus on the more complex, emotional, person-centered care.
That makes sense.
And remote health monitoring will get better too. Research by Robinson in 2013 and Chen in 2016 explored this. It'll allow for better oversight and quicker support for people aging at home.
And what about like the technical side of things? What advancements will be driving all of this?
Well, we can expect NLP, natural language processing, to keep getting better so robots can talk to us more naturally. Computer vision will help robots understand their surroundings and what people are doing. And machine learning will be huge for personalization, predictions, making those adaptable systems.
Okay, cool. And lastly, those ethical considerations we talked about. Will those still be important going forward?
Super important. Privacy, autonomy, dignity, as discussed by Wagner in 2019, those have to be at the forefront. And we need to work together, like different fields coming together.
Yeah.
Gerontology, ethics, psychology, engineering, as Cohen Mansfield pointed out in 2018, to make sure this tech is used in a way that truly benefits older adults.
It's definitely a complex landscape.
It is.
To bring this all down to earth a bit, let's talk about a specific AI-assistive tech called Mempal.
Oh, yeah, from MIT?
Yeah, from the MIT Media Lab. What's that all about?
It's a really cool project. It's a wearable, voice-controlled memory assistant.
Okay.
And it was developed with older adults, which is so important.
That's great. So it's specifically for those memory challenges that can come with age.
Exactly. It's designed to make those everyday memory issues less frustrating. You can just talk to it, you know?
Okay.
Like, hey, pal, where are my glasses? Or, hey, pal, did I take my medicine? And Mempal gives you the answer right away.
So it's like a little helper.
It is, and it respects privacy, which is important.
Yeah, definitely.
And it gives gentle reminders based on the situation.
Oh,
Like, it looks like you haven't locked the door, or you said you wanted to call your daughter later.
That's useful.
And for caregivers, there's an app that shows a summary of what the person's been doing all day,
That's it?
so they can stay informed without being intrusive.
Yeah. Yeah. And I heard it can even help doctors.
Yeah. MemPal can make a report for healthcare professionals, summarizing daily activities and highlighting any signs of memory decline.
So it's providing data for the doctors.
Exactly. Objective data that can help them assess cognitive health.
That's really interesting. So how does it actually work?
It's pretty cool. It uses a small camera